The subject of this presentation is compassion. Can it be taught? We talk a lot about compassion, but is this just something we have or we don't have? Is it something we can acquire? Are there forms of compassion? Let's just have a quick look at this. Compassion, can it be taught? The first question is, should it be taught? Is compassion relevant to the 21st century practice of healthcare? Or has science totally replaced the need for feeling? World Health Organization says that compassion is a necessary part of that process. That the reductionist or mechanistic view is not satisfactory, and that faith, hope and compassion are necessary components in the actual healing process. Is there evidence of that? Is this just a nice statement, or is there evidence? Well, for many years there's been evidence that compassion is healing. Let's just take this study from more than 20 years ago. In a trial of women suffering from advanced breast cancer, the group that were just given the best treatment of the time, the chemotherapy, the radiotherapy, survived for 18.9 months. The other half of the trial were put into self-help groups where they supported each other, understood each other, with a skilled facilitator, but no additional treatment. And so these women who shared concern and compassion and love with each other had a survival that was nearly double. That was published in The Lancet. And many more studies have followed that. So it is something we should teach, or certainly should be present in the healthcare, the doctor, the nurse, the physiotherapist. It's something which actually makes a difference to healing. Just think if a drug company produced a drug that does this doubling of survival time. It's something which gives hope that there is increasing evidence that hopelessness diminishes life expectancy. Hopelessness leads to the occurrence of diseases, of wear and tear, of cancer, of heart disease. And then where does it come in the code of ethics? Is it professional to be compassionate? In 2006, a report was compiled by the Royal College of Physicians in the United Kingdom. This was in consultation with the other colleges, with patient organisations, with the British Medical Association. And in that, they summarised it down in a document released the next year. And they said that medicine's a vocation, a calling, not just a job, a calling from yourself, from your own idealism, from the compassion within, saying, I want to make a difference to the world. A vocation in which a doctor's knowledge, clinical skills and judgment are put at the service of protecting and restoring human well-being. And they listed six aspects, six cardinal ethical values, which they expected doctors in the United Kingdom, and I think generally as a milestone. And they listed these: integrity, compassion, altruism, continuing improvement, excellence, and teamwork. Now, shouldn't we put excellence first? Why have they put these? Integrity, compassion, altruism. These are not just behaviours. Particularly altruism is a deep inner spiritual thing. Can we teach altruism? But that's not the subject for this talk. Compassion. I believe if we have integrity, if we have compassion and we have altruism, then the excellence will follow. We will want to be as good as we possibly can be. If we really care for our patients and their well-being, we will want to learn. We will want to be up to date. If we have integrity, the patient comes to us expecting us that we will make the best possible recommendation for them. Integrity will mean that we will study, that we will read our books, we will keep ourselves up to date. But compassion. The report says these are the values that underpin both the science and the practice of medicine, and form the basis for a moral contract between medical profession and society. It's very important we realise that we're not just scientists. We have a moral obligation to our patients, and these values are the ones that are the basis for that. Well, that's amongst doctors. What about nurses? The Royal College of Nursing in the United Kingdom says nursing values of care, compassion and empathy will be as important as technological and scientific breakthroughs to patients in the future. It's getting quite different, isn't it? The American Nursing Association puts this as its first provision in its code of ethics. The nurse in all professional relationships practices with compassion and respect for the inherent dignity, worth and uniqueness of every individual. And so amongst all involved in healthcare, this value of compassion, this practice of compassion is ranked important. So can we actually teach it? Well, there is the question of whether we can teach uncompassion. Let's look at that first. And this psychologist, Philip Zimbardo, he was the creator of what's, I suppose, somewhat infamous Stanford Prison Experiment, in which a group of college student volunteers who were good friends were randomly divided into guards and prisoners and then placed in a mock prison that he constructed. The instructions were that the guards couldn't physically harm the prisoners, but they could make the rules. They could make the rules. And now these were friends. But the outcome was so alarming that the experiment had to be stopped after just a week, because ordinary college students were transformed into either brutal sadistic guards or emotionally broken prisoners. And Dr. Zimbardo says that almost anyone, given the right situational influences, can be made to abandon moral scruples and cooperate in violence and oppression. We saw that in the guards in Auschwitz, the behaviour at the Abu Ghraib detention centre in Iraq, that people who are not evil monsters, if given the right institutional influences, can actually abandon their moral scruples and become deeply uncompassionate. So can we do it the other way round? Can we take ordinary people and make them more compassionate? It's a far nicer question. Well, Zimbardo also offers hope. He says we are capable of resisting evil and can even teach ourselves to act, he says, heroically. I think we can act compassionately if we work together to develop this. Just think for a moment, what factors at work make you less compassionate? And what factors tend to make you more compassionate? Just think of real situations where you've come away thinking you don't really care for the patients. You want to run away from it. It's Mrs. Jones with her whining and whinging. Or else you come back and say, I felt really warm in my heart when I dealt with that person. What factors work one way or the other? So how do we develop positive values? This is a young man I met many, many years ago. You can probably recognise the disease, some of you. Others will never have seen a case of this disease. Or have you? There's a young man suffering from lepromatous leprosy. You can see the loss of eyebrows, the collapse of the nose, the nodules of lepromatous nodules on his ears. But there's another disease he's suffering from, which I'm sure everyone has seen, and that is depression, sadness. Here we have an extraordinary thing. Here's a bacterial infection which has caused a psychological, emotional, mental health problem. And then we find some other patients I met right up on the border of the high Himalayas. And here is a 40-year-old man. Now he has dimorphous leprosy. It's taken away the use of his hands. They are paralyzed. The feeling has gone. He's burned some of his fingers off in hot ash in the fire. But when you look at his face, you see, what do you see? I think deeper than depression, this is hopelessness. Now, hopelessness is a disease of the inner being. It's a spiritual disorder, a fragmentation of our value, our purpose, our meaning in life. His wife has died, he can't work, and he's got a 7-year-old boy to look after. But just look at the face of that boy. He's caught the same disease as his father. Not leprosy. He didn't have leprosy. But he's caught the hopelessness. Hopelessness is infectious. It's infectious in societies. Transforms societies from normal societies into unhappy societies, malfunctioning societies. And the same way, if we can actually develop compassion within society, we find societies that function well, and the level of happiness increases. In the Bible, we find the story of Jesus. And Jesus, a role model for those in health, both Christians and Muslims, and indeed those of other faiths. It says, a man with leprosy came to him, and Jesus, filled with compassion, reached out his hand and touched the man. Did we feel compassion when we saw those pictures? When I show these, usually that's what people say. They feel compassion at the hopelessness of that man and his son. The same emotion here felt by Jesus. But he did something about it. He didn't just feel sad, didn't feel sorry. He reached out and touched the man. And compassion is that. It's not just a feeling. Compassion is something which actually drives us to actions. Actions that say, I care. Actions that say, I'll be with you. I'll walk with you through this process. It's here in the earthquake in Pakistan. Young Dr. Mary there from Emmanuel Hospital in India. She is treating this woman in the Pakistani earthquake. I don't know the circumstances. Maybe she's lost her husband. Maybe she's injured herself. But I think in this glance we see that compassion, and she reaches out to touch. Now, Robert Pope was an artist who suffered from cancer, eventually died of cancer. His foundation has given permission to use these pictures. And he painted pictures of his stay in a fairly leading cancer hospital. And these are pictures showing his emotions, how he perceived as an artist the care he was given. And as we see these, what sort of relationships do they show? Is there compassion or is there uncompassion? What about this? A specimen. The team not interested. Maybe some of them are students and they stay well back in case he asks them a question to which there's no right answer, for education by humiliation. How do you feel when you see this? Will it help you get better? Does it inspire hope? Would it make you more compassionate to be part of that team? And then we look at this. The contrast between different people here, maybe doctor, nurse, 2 attendants, a porter. But these are people who are with the patient. May not be the same religion. We don't know. But this man, obviously, to him, faith is important. And they are with him in that, affirming, because to him, that's important. And compassion means believing the values of the patient should be important to us. Not that we believe the same things, but that they are part of his inner being. And particularly at this end of life stage, they need to be valued. We walk with the patient. Now this one. This one, remember, this is painted by the patient. He was in the room. And do we perceive this as good care or bad care? Now, I think if you were possibly a hospital administrator and you saw this, it's really good, everyone's about their business. But if you're a really good hospital administrator, you say, well, who's caring for the patient? Everybody's busy being a scientist. The doctor, the radiographer, the other people discussing, looking, what's the structure? What's the abnormality? And the patient feels alone. Compassion is healing. Compassion means I care. But can it be taught? We've already seen, looking at those pictures, you feel compassion. An interesting experiment, again in America, they divided medical students into two groups. To one group, they showed a film of an American victory in the Second World War. To the other, they showed a film of Mother Teresa caring for abandoned, destitute orphans. And they measured the immune globulin. And the extraordinary thing was that in those who watched the war film, there was no change. In those that saw Mother Teresa, there was a measurable rise in immune globulin. So compassion is not only good for you, it's good for the patient, it's also good for you. There was a medieval, I suppose, system of spirituality which said if you actually come to know the right things, if you are orthodox in your thinking, that will lead to orthopathy, which is right feeling, and that will lead to orthopraxis, which is right practice. Now, let's put that into more sensible terms. The head, if you know the right things, leads to right feelings, which leads to right practice. Okay. What we so often do is to teach behaviour. That leads to stress in ourselves and the patient also. They will experience adequate care, but it won't touch the heart of the matter because the heart of the practitioner is not involved. What we need is to develop that, as they said, orthopathy, the right feeling, the heart. And if we develop that, we come closer to the patient. But the head and the heart are both in agreement. And they feed back to each other. The more we practice good, compassionate care, the more we want to practice it. We get the feedback that we experience the good vibes, the warmth of a compassionate relationship. And that tells us better how to express it to the patient. Our heart warms, and we are rewarded ourselves. Not just the patient who feels good in compassionate caring, it's we ourselves. So how do we start? This was a short paper in the Royal Society of Medicine journal, and Philip Hadridge proposed that if everybody in healthcare, doctors, nurses, porters, receptionists, if everybody did just one extra act of kindness a day, the health system would take a massive leap forward. I just think, the community nurse visiting a patient who says, shall I put the kettle on and make you a cup of tea while I'm here? Maybe a minute, 2 minutes longer. What a difference. The doctor giving the results to a patient who says, would you like me to phone your family and tell them? The patient's waiting, just to smile and say, I'm sure you won't be kept long. Just be acknowledged as human beings. And the more we smile at each other, the more we smile at others. Human behaviour is a positive feedback loop. The more compassion we express, the more we experience. And so just let's start with one extra act of kindness a day and just see how far forward our care takes and how far forward our own emotional well-being advances. Let's try it.